Monday was the deadliest day so far in the U.S., with 100 new deaths from coronavirus. Even though the number of deaths and infections are rising rapidly, U.S. President Donald Trump is considering cutting back on containment measures and letting businesses reopen, hoping to get the economy back on track. Is that too soon? What might be the consequences of having people going back to work? And later, as the number of cases in the U.S. continues to grow, the Trump administration is turning to leading technology firms for help in trying to contain the virus by using artificial intelligence to gather personal data. But there are serious privacy concerns. Should collecting information for the public good override privacy issues? Welcome to The Point, coming to you from Beijing. I'm Wang Guan, sitting in for Liu Xin. Over 11,000 cases and more than 100 deaths in a single day. The United States is fast becoming one of the worst coronavirus-affected countries anywhere in the world, unfortunately. This, while President Donald Trump suggests he might reopen businesses sooner than doctors and scientists would recommend. What's more scary, an economy at a standstill or an outbreak spiraling out of control? Meanwhile, U.S. Vice President Mike Pence said China is offering a greater degree of transparency than during previous epidemics. Is there a shift in the messaging campaign of the White House that for a while made blaming China a top priority? For more insight, I'm joined tonight via Skype by Richard Chasdi from Department of Political Science of George Washington University. On the phone, we have Zhao, Research Fellow at the Chinese Academy of Social Sciences here in Beijing. Gentlemen, welcome. First, let's hear what the U.S. President Donald Trump said on Monday.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
We cannot let the cure be worse than the problem. Mr. Chasdi, what do you make of President Trump's remarks?
Well, President Trump, in general, has been vacillating in terms of which direction to take. And part of the problem is that he hasn't been listening to some of his top advisors who are experts in the field, who are subject matter experts. It would be extraordinarily premature, in my judgment, for President Trump to open up some of the restrictions or relax some of the restrictions in place to contain this. And there have been some real questions on the part not only of governors in the country and mayors in the countries, but there was a disagreement, for example, between the Federal Emergency Management Agency administrator and the president about whether, in fact, the Defense Production Act of 1950 has actually been invoked or not. So there's some real confusion here. And I think that these aren't mutually exclusive domains in terms of providing stimulus to the economy, which is what's needed. But at this juncture, it's critical that there be an effective and sustained set of protocols in place to flatten the curve, to ensure that the spread of this virus doesn't continue unabated.
Well, Mr. Zhao, talking about President Trump's remarks and attitudes towards the containment of the coronavirus, he also said that he plans to relaunch the U.S. economy not longer after a 15-day shutdown period. Is that just wishful thinking, given the situation right now on the ground?
I think so. There are 3 points I want to make. Number one, the numbers currently, the new cases increasing in the United States does not agree with the president. So far, it's still following the exponential curve, and it's increasing dramatically, as you just mentioned. There are thousands upon thousands of cases, the newly tested and confirmed. So far at this point, it's hard for me to see any proof that this curve will peak in 14, 15 days, or even turn downward. So this is not believable. And secondly, there's no real professionals or doctors or anybody from the CDC or from the WHO has said that anything to support the president's claim that in 15 days the U.S. could relax the restriction. And thirdly, I think this is really a waste of China's experience that China has provided to the world, and particularly to the United States. If you look at Wuhan and Hubei in general, it took about more than 2 months to get things back to normal and to take the virus under control. So to say, if you look at the pictures in the United States today, it's comparable to the early stages of Wuhan and Hubei. So to say that it can be controlled in just 15 days and relax everything that's been measures that's been put into place, it's really, for me, unbelievable at this point.
Well, Mr. Zhao, talking about measures, there has been nationwide lockdowns, locking down cities, closing restaurants and bars and non-essential activities. But what about enforcement? Because we know that Wuhan, despite the initial issues, later on, there was strong enforcement. You know, people were not just advised to stay indoors, but there was strong enforcement. And those who get out of the way, who get out of the places they're not supposed to be, are, punished. So what can be done when it comes to enforcement of the lockdown in the United States? Because some people are complaining on social media in America that there has not been aggressive enforcement.
Well, to a lot of Americans, probably Chinese experience and Chinese quarantine is too draconian, and it's hard for Americans to follow. If that's the case, they can look at other East Asia countries like Korea or Japan or other places like Singapore. I mean, they also applied very strict measures and also lockdowns to control the population flow to really, flatten the curve. Most importantly is testing. And so far, I think the U.S. is still falling behind the curve of testing. There's not enough testing sites and testing kits to make sure that all the cases have been discovered and quarantined. So without that, you don't have real understanding and control of the people have been infected. Therefore, you have to enlarge the number of people who has been putting into the lockdown. So therefore, I think right now the most important thing is still push forward with more and more testing to make sure that they have the parameter of the infection, and that later on, when you have those people under control, you can gradually relax the people outside that circle. And so far, that has not been realized.
Well, I want to read out a tweet from a director at the Johns Hopkins Center for Health Security. He tweeted his fears after Trump said that he will reconsider the nation's social distancing policy. He tweeted that anyone advising the end of social distancing now needs to fully understand what the country will look like if we do that. COVID will spread widely, rapidly, terribly, could kill potentially millions in the year ahead with huge socioeconomic impact across the country. So, Mr. Chasdi, do you think that is too alarmist, or that is a legitimate warning?
No, I don't think that's too alarmist. I think that those that are proposing removing or constraining the social distance policy at this juncture are just flat out wrong. Part of the problem here is that we've been receiving mixed messages. In addition to the problems in terms of supply, in terms of surgical masks and gloves and other protective gear, and in addition to this delicate balance between prevention measures and democracy here in the United States as we know it, which impacts the likelihood and the desirability of cracking down further on those that are, for example, are going down to the mall and looking at the cherry blossoms here in Washington. The idea is basically that this sort of threat is something that we have to confront seriously. And there are those, unfortunately, and this is not only true in the United States, this is true even in Italy, for example, and other parts of Europe, for example, people who are not taking this as seriously as they ought to, even though young people have been hit much harder than originally anticipated with this virus.
All right, I want to shift gears a little bit, gentlemen, and talk about the White House's messaging campaign vis-a-vis China. On Sunday, U.S. Vice President Mike Pence said on Fox News that while the Chinese government should have done more to stem the coronavirus outbreak, according to the U.S. Vice President, China is being more transparent than during past contagions, he said. We were able to send a team of our top experts in the middle of February to look at the raw data to understand what's going on in China, and we'll continue to work on a basis of cooperation. Mr. Zhao, does it sound like a break from White House's previous messaging campaigns against China?
Well, it does sound like a softer tone towards China. And adding that to what had happened in the last 24 hours when President Trump stopped calling the China virus, I think there's a relative improvement on the U.S. side in terms of looking at talking about the origin of the virus and talking about or shifting responsibility towards Chinese side. However, I think this is not enough to really put the two countries' relations back on track, because Secretary Pompeo is still out there earlier today talking on Fox News, still using like Wuhan virus, still accusing China of various responsibilities. And so I think at this point, there are either an inconsistency within the White House or the Trump administration, or they're playing two sides. On the one hand, trying to continue pushing forward this ridiculous idea that China should be fully responsible for what's spreading in the United States, therefore beefing up their political support, and on the other hand, trying to get sort of seeking a better relationship with China so that they can work on fighting the coronavirus. But I think they cannot walk on this line forever, because they need to have their tone consistent about U.S.-China relations. And without cooperating between the two countries, if you look at the larger picture, there won't be any effective international cooperation to fight against this virus, and more people's lives will be lost.
Okay, thank you very much, Mr. Zhao. Mr. Chasdi, there's China bashing on one hand, but there's also racism and xenophobia on the other. I want to show you a tweet from President Trump. On Monday, he said, "It is very important to protect the Asian American community and that the spread of the virus is not their fault." But he went on to say, referring to the Asian Americans, that they're working closely with us to get rid of the virus. Some Asian Americans are apparently furious. Elise Hu, for example, who is a host at National Public Radio, said, "My head is about to blow off because, my God, Asian Americans are us Americans. We are not some subgroup working with us. We have dealt with casual racism and the weird subordinate status enough. This racism should not cascade down to our Asian American children." Mr. Chasdi, what do you make of those President Trump's remarks? I mean, even if a person means well or want to mean well, some subconscious racism can still slip out of one's mouth, right?
Well, I think those are racist comments, and my feeling is that it reflects a mindset where the president and those who think along his lines are viewing this as an us versus them situation, and viewing Chinese Americans as outsiders intrinsically in statements like this. Chinese Americans are as American as I am. And this is part of the problem in terms of the Trump administration in general being divisive and antagonistic, and certainly not being inclusive, which is the way that would be most desirable here. So these are extraordinarily unfortunate and shameful remarks, and I think that people have to be very careful in terms of how they approach public comments and their own behaviors. One of the things during times of stress that we find is that people act out against those who are considered to be a part of the out group. And this is something that simply can't be tolerated.
Exactly. Hopefully, policymakers will heed your warnings and advice. I want to thank both of my guests, Richard Chasdi from George Washington University in Washington, D.C., and Mr. Zhao Hai from the Chinese Academy of Social Sciences. We'll take a short break, and when we come back, we'll talk about artificial intelligence and how that can help the United States combat the coronavirus. Stay with us.